Good afternoon, everyone. Thank you so much for joining us at this special community conversations. We are so excited to have our panel here today and some special guests, and I'd like to introduce them to you. But before I do that, I want to talk to you about the reason for this important conversation. You know, the Community Health Endowment has been doing our Place Matters project now for a number of years. We're now in our 4th edition. And this year, a new map that we added is related to older adults. This is the map that I want to show you. This map tells us in these pink areas where there was a population of at least 5% of individuals who are over the age of 65 or 75. These blue areas tell us where today there are a population of at least 5% of individuals who are 75 and older. What is this telling us? It's telling us that our older population is growing, and it's going to continue to grow as baby boomers have now turned 75. So we're going to talk about that important topic today, and I'm going to turn it over to our moderator in a moment. But first, I want to introduce a couple of guests that are with us today. We have with us David Carey, who is the director of the Lincoln-Lancaster County Planning Department, and Randy Jones, who is the director of Aging Partners for our community. These are folks who are working on behalf of our city to address this issue, this new demographic shift. And so they will be available to answer any questions you might have. But first, we're going to turn to our panel. And I have the privilege to turn it over to Dr. Randy Bretz as our moderator. Thanks so much for being here, Randy.
When I was 17, it was a very good year. I know I'm not going to sing the rest of it, but it was a very good year for small town girls and soft summer nights. We'd hide from the lights on the village green when I was 17. When I was 35, it was a very good year. It was a very good year for blue-blooded girls of independent means. We'd ride in limousines. Their chauffeurs would drive when I was 35. But now the days are short. I'm in the autumn of my years. And I think of my life as vintage wine, from the old kegs, from the brim to the dregs. It poured sweet and clear. It was a very good year. Now, that song was first released by the Kingston Trio in 1961. Then in 1966, it won a Grammy for Frank Sinatra. But it pretty much sums up the baby boomer years. And I have a front seat on the boomer bus, as I call it. When I started kindergarten, I went to a brand new school that was built by educators for a lot of youngsters coming out of parents that had come back from the war. Those were called the baby boomers. Then I attended a public university. There were 5,000 when I started at that university, and in just 4 years, the enrollment grew to 10,000. We burst the seams of that institution. My wife and I bought a house in a suburb that was built for baby boomers. We raised our family there. We raised our grandkids there. They came and visited. We hosted a lot of family visits over the years. Well, now we're in our mid-70s. And once again, from our seat in the front of the baby boomer bus, we're seeing what lies ahead. Just next week, we're going to move to a townhome. We've sold our home of many, many years. Well, we're still very active in Lincoln. We're retired, but we see our doctors on a very frequent basis. We've put some money aside for long-term care. And we're at the leading edge of what society is beginning to realize is a significant shift in dealing with older folks like us. And that's the purpose for this event today. Baby boomers turning 75. What lies ahead for Lincoln? Well, today you're going to hear from two people who have put a magnifying glass on the boomers in and around Lincoln. And they're going to share how Lincoln will be impacted by the baby boom generation. Our first panelist will be David Drews. He's Director of Research and Data Analytics with the Community Health Development Partners here in Lincoln. Some of what he has to share will help you become aware of such things as the disability challenges that we face in my generation, the workforce issues that we're causing, and even the housing challenges that we face. Next, we'll hear from Jaylene Carpenter, President and CEO of the Nebraska Healthcare Association. She's going to point out that boomers from rural parts of our state are moving to Lincoln and to Omaha. She's also going to point out that medical costs are expensive and that Medicare doesn't cover all of it. And she'll talk about some information about long-term care and some of the issues that our generation is facing. And then finally, we'll hear from Teresa Costello-Raditz. She will share the story of how she and her siblings manage their aging parent situation. She'll give us the better understanding of the legal, the financial, and the health issues that lie ahead. I think you'll learn from what Teresa has to share as you and your family ride on the baby boomer bus. So now let's turn our attention to David. And David, what do you have to share with us?
All right, well, thanks so much. Happy to be here. And my background, I was over at University of Nebraska, Omaha for 18 years doing demographic and other data research work. So as part of that, I helped Lancaster County with their population projections back in 2009. And then we updated them for the new comprehensive plan here again in 2019 through 2020. So I have lived in Lincoln for 6 or 7 years, doing both my undergraduate and graduate degree here. Met my wife here, so I have very strong feelings for Lincoln, but now I'm in the Omaha area. So I'll walk you through some demographics that we see as the baby boomers leading edge starts to hit age 75. I will note that we'll share these slides so people don't have to take a whole bunch of notes. My email is up on the screen, so feel free to reach out to me to receive things directly, or they might even be posted on the Community Health Endowment website, things like that. So very happy to share and look forward to this conversation. So I am a resource, so if you would need data for anything, feel free to reach out anytime. Just quickly about our company at Community Health Development Partners. What we do is bring healthcare services to areas that need them, whether that be rural locations or places that are low income and have certain socioeconomic challenges. We are out of the Lincoln, Omaha area, and have about 25 employees working on 4 different projects across the United States. So our focus again is in underserved, so it's always working a lot with those need style data for personal socioeconomic situations. Okay, so when we take a look at numbers, a lot of times where we go is to the Census Bureau. So we just completed the 2020 census, and I just wanted to highlight that because so much of our age-related data comes directly from the census. It's not all out yet, like only things we have right now are for voters age 18 and older and kids under 18. But eventually we'll get detailed age data, and that's what the basis of all our projections and things are from. So we did have more time to respond to the 2020 census. That led to some better response rates. And we also had a lot of partners who assisted us. So if you had a special census outreach during the 2020 timeframe, especially on the pandemic, just wanted to say thank you because those efforts were really needed to get people to self-respond because that's where our best data comes from. When we look at this table of results, what we see on the left side of these 2020 response rates, and I'll highlight Lancaster County to show that nearly 80% of households responded directly to the census, and that was 3rd highest in the state, following some of the suburban areas of Omaha. And we can see that it greatly exceeded the Douglas County response rate, which was less than 75%. So this was an improvement of almost 4 points versus 10 years earlier in 2010, and that has a lot of impacts. So where we see it the most is in the actual count itself, which came out about 2,500 higher than what the Census Bureau estimated. So that has a lot of impacts from the standpoint that the census is done for 2 main reasons. One, to divvy up political representation, so the congressional seats, the unicameral seats, etc. And then secondly, population-based formulas determine how much federal funds come back to local areas. So about $21,000 per person over the course of the decade. So you multiply that by the additional 2,500 people that the census found due to that good response rate, and you're over $50 million more that the county will have available to it for schools, health programs, etc. Also wanted to highlight that Lincoln itself as a city, among all those cities with more than 250,000 population, had the #1 best self-response rate in the country. So I know our friends at Lincoln Lancaster County Planning, who helped spearhead some of the efforts to have the good census count, they took a lot of pride in that number, and it was definitely well deserving. Okay, so talking about our baby boomer population, you'll note on my slides that I try to put a takeaway up at the top and then our exact title the next row down for what's being shown. So this is just a look at our population by single year of age. So starting on the left, we have newborns under 1 year of age, and then extending all the way to age 84 at the far right. And I have color-coded these generations here. So baby boomers right now, born 1946 to 1964, are ages 57 to 75. So you'll see that orange bar on the far right, how much higher it is than all the blue bars to the far right. So you can see that jump and just how much bigger the baby boom population is than the generation that preceded it the prior decade. And then you also see how long this baby boom generation is. And that's what's unique about the baby boom, that it spanned almost 20 years. After World War I, there was also a mini baby boom that only lasted 2 or 3 years as people came back from the war. But this lasted almost a full 20 years. And the impact of that is that then there's another bump in population, kind of the light orange bars in the middle there for what we call Generation Y, or the millennial generation. And they're now primarily in their 30s and have kind of in that shifting part of life of forming families, going from renting to homeowning, and starting new work or advancing in their careers. So that's where they're at. And the millennials are having their own kids, which would be like grandkids for the baby boomers. So we see some rising births there at the youngest ages. So that is unique. Stuck in the middle are the Gen X population generation, and that you can see how those kind of a gray bar are much smaller than a lot of the orange bars either before or after it. So that's kind of where the crunch comes in, because a lot of times Generation X folks are caring for an aging parent or their teenage children. So that's what we have, and we do see that the stair-stepping pattern to older ages, I should refer to them maybe more as like the later edges of the baby boom, where they were, we haven't seen the outmigration or the mortality rate start to kick higher yet for those. So that's why it kind of stair steps upward among people in their early 60s. All right, here's a graph that will just look at putting into perspective what our growth in 75 and older population has been and what it currently is going to be. So the orange bars are what's happened in prior decades, starting back in the 1970s and coming up through our most completed 2010s decade. So on average, we were growing about 2,000 individuals over the course of a decade who were age 75 and older. But now, as the baby boomers age into this demographic, we're going to see growth that's in around the 10,000 per decade range, or basically 5 times higher than what we have seen in the recent past. So that's just something to put into perspective what this new wave of people hitting the 75 and older demographic is going to be relative to our recent past. You can note also in the 2040s, that when we get there, it will go much more to the typical pattern after all the baby boomers have aged into 75 and older, and that smaller Generation X portion starts to hit that age. All right. So moving on, what we have here is another comparison. So taking a look at, rather than 75 and older over time, to take a peek and see what it is at 75 and older versus another population group of kids under 5. And we see the two lines, as they start back in 1950, then we see the bump in children in 1960 from the baby boom itself, so kids born in the 1950s. And then the kids have grown and the seniors have grown. But now, as we see with this dashed line, where we are in 2023, just about to hit that year, the cross point. And you can see that steep rise in the orange line showing that the age 75 and older population is not only going to exceed kids under 5 in Lancaster County, but greatly exceed it by the time we get to 2050. So this has some impacts in this overall trend. So I'll highlight them here with this call out in that, there's a limited pool of dollars. So when we look at budgets, a lot of times programs have been developed for kids, anti-poverty programs, things like that. Well, seniors have poverty too, and now we're going to have a lot more seniors as we go forward. So that might shift some of the focus in where various organizations or entities put their budget. One thing we know from our voting patterns is that older persons tend to vote at very high rates. So constituents of policymakers are going to be in their ear for what's important to them. So the office holders might well listen to the seniors and allocate more resources to this growing 75 and older demographic as opposed to young children. So just to note that there could be some conflict, some debate and discussion over that. Also based upon this trend, would you rather be in a child care field or an elder care field? And we can see we're going to have a lot more needs in elder care than what we used to. And it seems like just yesterday that the baby boomers were starting to hit age 65. So we've had 10 years to kind of prepare for this point, but just it's taken a lot, and I'm not sure if we're fully ready yet. Even though we've kind of known about it, it's just really hard to get there. So notice that, and I think that trend will be something that definitely people pay attention to. Another way to look at this change in population is to work and focus on something called the prime age workforce. So that's like 25 to 64-year-olds. So prior to retirement, but after college. So people who've completed their degree might be 25 and then up through retirement age. So this is a graph of that for Nebraska statewide. And what we see here is this generally upsloping pattern to where it peaks out in 2018. And then for the 10 years that follow 2018, it's going to continue to decline until it finally bottoms out. So this is something I showed at a state chamber meeting a couple years ago, and you could literally hear gasps within the crowd. Because even prior to the pandemic, finding workers was the hardest part of businesses from what we heard from people in the chamber. So this trend only exacerbates that difficulty to find workers. So it's something that we need to focus on. And when we look at this as a percentage, Nebraska, shown on the graph, is losing about 2% of that prime age workforce. Locally here in Lancaster County, not going to have that problem because Lancaster County pulls in enough students, it pulls enough young workers where we're actually going to see a rise in prime age workforce locally in Lancaster County. However, each and every one of the surrounding counties that commute in, so Seward County, Saline County, Otoe, or Gage, they're all going to lose 10% of their prime age workforce over the course of 10 years. Okay, so Lancaster County is not without its workforce challenges from that perspective, given how many people commute in for the work purposes. So that's something on workforce that we can see as the baby boomers age out of their prime working years. Okay. Another piece that we see as a trend is in people living alone, okay? And I have this split here between men and women because for a long time the face of aging was an older widowed lady. But that's not so much the case anymore. So we see on the right side kind of the stair-step downward pattern of over time, fewer women who are seniors are living alone. And conversely, now there are more older men who are living alone at the same time. So as a personal example, my parents who are in their 80s, my dad has 3 really good friends and they have all outlived their wife. So older men who are living alone might have some certain challenges or certain needs. So if you think about it, they probably over the course of their lifetime haven't done a lot of the cooking or the cleaning that their spouse has probably done. So what services might be needed by especially that group of older men who are living alone? Living alone, of course, is a risk category in case there is a fall or some other kind of health emergency, when you do have two people living together, not only do you have that companionship, so the positive social aspects, but also the ability to give each other rides to the doctor, or just the companionship and the economic impacts of having maybe two Social Security checks coming in rather than just one. Okay, to kind of finalize things here and realize that there are a lot of impacts for populations related to disabilities, wanted to show this graph. And it's very detailed, but I'll explain that there's just the same pattern repeated over and over. So at the lower left, we can see a specific type of disability, in this case being blind or having a vision difficulty. And then each of the bars represent an age group, a 5-year age group from 60 up until being age 90 or older. So if you look at the patterns, they all stair-step upwards. So with each additional 5 years of age, you are having higher and higher rates of disabilities. So when you look at as an example, the one in the orange in the middle, which is what they call an ambulatory difficulty, the ability to walk or climb up stairs. When you're at age 75, the percentage there is about 20% having that kind of difficulty. Well, that's double what it was when people were 60. Okay, and you can see it's 11% on the graph there. So between age 60 and 75, the ability or the difficulty in walking upstairs, it doubles. Okay, well, as you go up toward 90, it's going to be over 50%. So this is the kind of thing we talk about housing and housing structure, ranch style housing as opposed to those with a lot of steps. Things like this have to be considered. Okay. The other one I'll point out is just for any disability, which is on the far right. When you get to age 75, approximately 35% have some sort of disability, whether that's hearing or being able to care for themselves. We also see that's a doubling from back when they were 60, when it was 18%. And again, finally, when you get to age 90, 3/4 of your individuals are going to have a disability of some sort. So we're going to have some others on the panel talk about some of those challenges, but the numbers do really bear it out. And the reason I like showing this detailed graph is, again, certain groups might have particular interests. So you can see how those disabilities rise for cognitive issues, in case you have any mental health providers who are listening on the call, or for being able to live independently in your own home and not need maybe different assisted living facilities or things of that sort. Okay, the final slide that I have for you guys today is to show diversity and how it's changing across age groups and across populations. So these are Lancaster County numbers, just shown in a table, starting back in 1990 for 3 different age groups, kind of your kids under 20, people at middle age from 20 to 60, and then in this case I use seniors for 60 and older. So we can see that those numbers are increasing over time, and we project them to continue doing so. When we look specifically at seniors 60 and older, currently about 8% of seniors are a person of color, but that's going to double by 2040. So in just 20 years, it's going to go from 8 up to 16%, and then over 20% persons of color in our senior demographic by 2050. So there can be some challenges here. For example, when you look at this aging population, it's still predominantly white, even though it's growing more diverse, but that younger population who might be providing the care is a more diverse population. So there could be some language issues there. There could be some cultural issues. So as we talk about care and providing for these the needs of seniors, there can be some challenges. So just wanted to highlight that. And we do see, of course, with the population becoming more diverse, that there are associated socioeconomic challenges with that. Lower levels of education sometimes, higher levels of poverty. So these trends do have an impact, and we have to understand how they play into a larger narrative. Okay, I'll note here that we do have the link up to the projections report that was done for Lancaster County. It has a lot of detail. I spent a lot of hours writing it, so feel free to go check that out. has a lot of neat graphics beyond what we talked here, specifically related to seniors. So with that, I'll turn it back over to Randy and our next panelist.
Okay, thank you, David. I will note that David's PowerPoint will be available on the website for the Community Health Endowment after today's presentation, and as well a video of this presentation. And by the way, if you have a question as we go along, you can type it in on Facebook and we'll get it up here to the panel, or you can type it in on the Q&A if you're watching on Zoom. Well, next we're going to hear from Jaylene Carpenter, and Jaylene is from the Nebraska Healthcare Association, and she's going to point out some additional interesting things that are coming forward.
Thank you very much. All right, so the baby boomers are turning 75. There's some great data to highlight the fact that we are seeing the silver tsunami that we've been talking about. Dave did a great job pointing out we knew it was coming 10 years ago. And interestingly, I'm not sure we're as prepared as we would need or like to be. And particular in Nebraska, we have the workforce issue. It's interesting. I'm going to talk a little bit about where Lincoln stands. Obviously, we still feel a workforce crunch, but there's not as critical of a need. I wanted to start by showing you a slide of what the options are for senior housing, senior care, because the boomers created this very messy slide I'm going to show you. And I say that because you're coming off the silent generation, which is very, I will say, compliant, in that it was very traditional. I age, my doctor tells me I need more care, I go to a nursing home. And that was the only option for a very, very long time. And the silent generation just took it very quietly. The boomers, they demand options. And so I know this is a lot of information on a slide, but these are the multiple options when it comes to senior housing, senior care, of things that are available to those over 75 who need assistance. And as David pointed out, with every 5-year increment, your level of disability, or those age 75's level of disability, is going to increase. So I'm going to take it from left to right. On the left is going to be what is the least amount of cost and the least amount of what is called care or supervision. So on the very left side of the things are going to be adult day programs, where I'm still living at my home. My spouse might need a little bit of time to go run errands, and so I go to some activity programming. On that little bubbles, they overlap for a reason, because they're sometimes offered in like one site offers multiple of these options, or they overlap, and I'm going to talk about that when it comes to home-based care in an assisted living community. But on the left is going to be 55 and older housing or apartments, retirement communities, which are different than independent living communities. So these all kind of intersect, and they're really just good to understand of what are my options and how do I start planning out of what would best serve my needs. And we're going to talk cost later, but also what can I afford? Because generally, when you think of senior living and senior housing, the more either care or luxuries you would like, the more it will cost. So the left is going to be retirement communities, independent living. Basically, you're living in a community with those that are over a certain age point, and you're provided with entertainment, maybe an emergency response type system, like a call alert, but I'm not receiving any care. I might have the option to purchase meals, but nobody's cooking for me. I'm still very independent. As we move along to the right-hand side, our level of care or supervision increases, and so do some of them, our cost is going to increase as well. What's interesting is in-home senior care on this particular chart is lower, and it comes to the cost perspective. The current labor market is driving that cost upward exponentially, to where I'm going to show you some data from Genworth Financial later that's talking about how in-home care is becoming exceedingly more expensive than other care options. In-home care is also very broad. When we think about services that I can receive in my home, people assume that means anything I might need, but that is sort of a misnomer, because it really is like the full spectrum. I can have somebody deliver my groceries, and potentially, help me set up my meds for the week, all the way to I'm needing somebody to help with my bathing and my dressing and what we call activities of daily living. To David's point, typically if there's somebody residing in their home who needs assistance with bathing, they need assistance using the restroom, they generally live in a dual home. Means that they're living with somebody else who, while there may be a home caregiver coming in, there is somebody who's there 24/7 who really is the primary caregiver, and very uncompensated primary caregiver, I would add. As you go up, there's what we call assisted living and continuing care retirement communities, or CCRCs. So I'll talk first at CCRC because, as you see, it's a big, big bubble. It's because it was originally intended to cover all of the aging spectrum, meaning I can move in as an independent living. I have my own apartment. I'm very independent. They offer an assisted living, which I'll talk a little bit about, and then they move all the way to skilled nursing care, which means I'm needing total assistance. These models are incredibly popular. I know Teresa is going to tell us a fantastic story of how they're not so simple in the care transition. So the goal is that I can stay on one campus as I age. However, transitioning from one level of care to the next is not as simple or easy as people would like to assume, because you run into the problem of I am still fine. I don't need that next level of care, or I don't want to incur the cost of the next level of care. An assisted living is generally a standalone community or a facility. I want to point out, when it comes to an assisted living, there's something really important to understand about Nebraska, in that assisted livings are regulated at the state level. Nursing facilities are regulated at the federal level. That means there's standardization across the country. So every nursing home is going to look and feel very similar because they have a federal regulation. We do not have that in assisted living. They are regulated at the state level. And I say that because many times when people are doing their planning, their loved ones or family that are helping with that planning are out of state. So someone in assisted living in Arizona, and they can do this. This assisted living can do this. Why can't you provide this level of care? Well, that's because in Arizona, their regulations are different. So I say that to be really mindful of, you can't compare apples to apples when it comes to assisted living. It really is pretty distinct to our state. Our state has taken the approach that assisted livings are considered a social model and fall in line with what's called home and community-based services. So they, similar to any service that you could receive in your home, you can receive in assisted living. It also, because we have regulated it to be a social model, there's very limited care provided. I think of it a lot of like, I'm not going to physically touch you. I'm going to give you your medications, you're going to take them, but I'm not going to assist with actually ensuring, like, I'm not going to physically help you do that. I'm not going to physically feed you. I might give you utensils and give you supports, but I'm not going to actually do it for you. So there's a little bubble that kind of comes in between assisted living and a full nursing home, which is a concept of an assisted living memory support care facility. These are incredibly popular in Lincoln. We have a lot of this model, which is a very small community, like 8 to 18 beds, that have specifically directed their care towards memory care. I'm going to talk about payer here in a minute, but these are a really unique and good option, and something that Lincoln is blessed to have a lot of options with. On the full right, the highest level of cost, the highest level of care is going to be a nursing facility. And I'm going to show you some information about the numbers of those types of facilities in Lincoln. What I would note is the percent of people who actually will end up needing nursing home care is relatively small to the overall population, but as you age, your probability increases, just like David articulated, because your disabilities or comorbidities are increasing in that 5-year increment. So if I live to age 90, I am going to need more care. I alluded to this. What does it cost to fall in all of these buckets? This is something that I do not think people are mentally prepared for or understand. These are the median cost for an annual 1 year of this level of care. So you see a full-time home health aide is more expensive than a private room at an assisted living. Now, there's some overlap there because generally people don't employ a full-time home health aide, so sometimes that cost is significantly less, but if I were to have full in-home care, it is more expensive. You combat that with the workforce issues, and so there's a limited availability because we're vying for all the same caregivers. All of these different populations are all needing the same caregiver, and so sometimes you run into barriers of you're not able to access home health care because there's no one to provide it. An assisted living is right around $50,000 a year. This is an average. Remember what I said, the more luxuries and the more care you are wanting, the higher that number goes. And then below that is a nursing facility. So if I were to need a nursing level care, I will just give a quick description. The reason it's called a nursing facility is because there needs to be a nurse to provide that care and supervision. So there's a requirement that there's a nurse on staff at all times. An assisted living does not have that requirement. So the reason that cost is so high is really truly that it takes a lot of physical labor and certified, qualified people to run these facilities, and wage inflation has just dramatically increased that cost. But if you're looking $100,000 for 1 year of care in a nursing facility, and you're going to say, well, it's okay, I have Medicare. Medicare is going to pay for that. No, Medicare does not pay for long-term placement in a care facility, nursing home or assisted living. They will cover, in certain instances, if you qualify, a short stay for rehab. Can't stress that enough. It's not guaranteed coverage for any care. If you have planned, there's other options to pay for your care, which would be paying privately, meaning I have had investments in resources that I can pay for my care. Or if you're really blessed, you have long-term care insurance, which quite frankly has continued to only decrease with the boomers. They spent their money on way more fun things than long-term care insurance. So that option is very rare. If you do have it, that is an amazing asset for you. Do not expect it to pay for your full needs. It will probably, by the time you need it, cover hopefully 50% of that care or the cost of that care. So that comes down to Medicaid. And I will just briefly say Medicaid is when you've exhausted all of your resources, the state will assist you in paying for care. Most commonly seen for nursing facilities, what I would just educate you on is that nursing facilities, what they're paid by the state does not cover their cost of care. So if you're saying, don't worry, Medicaid's going to take care of me, if that's your option, you need to be thinking that facilities may not accept you because they have to be able to run the business. And so if they're going to be cognizant of that. Let's look at Lincoln. So Lincoln has 13 nursing facilities, 2 new constructions in the last 5 years, 40 assisted living communities, 5 have been constructed in the last 5 years. You're going to see a continued shift of construction of senior housing. We are behind, but that is the push. You will not see new nursing homes. The acuity shift has occurred. That particular industry is probably saturated on where it's at. There might be a blip of time when that tsunami hits the high point where it's a little rough, but that as we see an acuity shift, assisted living and senior housing is where we expect to see growth. I will end with one quote that I love that I think sums up what I hope you got out of this, is that retirement is wonderful if you have 2 essentials. You have much to live on and much to live for. So I hope that gave you a lot of good information and also got you thinking a little bit. Maybe the blood pressure went up just slightly, thinking about, wow, I wasn't aware of all those options and what we need to be planning for. And with that, I'll turn it back over.
Okay, thank you very much, Janelle. And just a reminder, if you do have questions for any of our panelists today, you can type those in on Facebook, or you can also do it in the Q&A part of Zoom. Well, finally today we have Teresa Costello-Raditz. And Teresa is going to kind of take all these numbers and facts and figures and turn it into a personal story of how she and her siblings dealt with their aging parent. Teresa?
Thank you. So I just wanted to kind of set the stage for, what we're really talking about. I mean, we're all going to age, and most of us don't want to think about what's going to happen. A lot of times I think we just put that in the back of our minds and we think, well, that's in the future. And we hope that we'll all age, but it's going to happen. And we hope that we'll all be able to live comfortably in our own home and perhaps, pass away in our own bed. And that's, a great dream to have. And actually, that's actually what happened with my in-laws. They were very lucky. My father-in-law passed away at home after a short stay in the hospital in hospice, and my mother-in-law passed away in her own bed, which is what they wanted. But that's not the story I have to tell about my parents. It was very different. They weren't so lucky. In about 2017, I found myself being really the primary caretaker and decision maker for my parents. My dad had had a lot of health issues over the years, in and out of the hospital, surgeries. He had been in short stay rehab a number of times. And my mother had always been very healthy. But at that point, had started having some things happen. She fell on the ice and broke her arm. And at this time, they were still living in their own home. And she decided one day that she was going to take my dad's wheelchair down the stairs to the basement, and ended up tumbling down the stairs with the wheelchair. So things were starting to happen. And early 2017, my dad had a hospital stay where he, at the time he was released, he was very weak and not able to go home. And so he spent quite a bit of time in a skilled nursing rehab center. And at one point, we didn't think he was going to be able to come home at all. He was very weak when he was discharged. He couldn't even walk. And at first, as Jaylene said, Medicare paid for some of that care. But eventually Medicare, wasn't going to pay anymore, and my parents were paying out of their own pocket, and they were just terrified at the cost. It was very, very expensive. And my dad was determined to get home, so eventually he did. They arranged for in-home care, and my mom, was going to care for him as well. And so that was their plan, and he came home, and that worked for a short time, but eventually, pretty quickly, actually, it became evident that was not going to work long term. So just to step back for a minute, I am one of 6 siblings. I am the only daughter, and I only have one sibling, my older brother, that lives here in Lincoln with us. So I didn't have a lot of local help. So it was really falling to me for a lot of these things. And at the time, and I'm still working full time, I have my own family, my own home to take care of. I had a full plate already. So this was a lot to take on. And then at that point in 2017, when my parents realized, they weren't going to be able to continue as they were, my dad took it upon himself to make a decision to move to assisted living. He didn't really consult any of us. He just decided, and he didn't even consult my mom. He said, this is what we're doing. And so they moved to assisted living. And at that time, I should say to my mom, it had started to show the signs of dementia, although, at the time we weren't really sure what was happening. So we weren't really too concerned about it. We were more focused on, okay, they moved to assisted living. That was a good thing, right? It felt like a relief. They were safer. I felt like I wasn't going to get those calls, in the middle of a work day or in the evening when I had to rush over to my parents' house to, handle some crisis that was happening. So they got along in the assisted living pretty well. My dad did end up having to have some additional care, which they had to pay for in addition to the assisted living. As Jaylene said, that kind of transition isn't always, you think assisted living is assisted, but it's not necessarily so. And then they got along pretty well. I will say, there was still a lot of things that I had to do for them. At that point, my mom was still driving when they first moved there, but I was trying to discourage her from doing so. So I was spending a lot of time, taking her shopping, going to doctor's appointments, haircuts, all those things that we all need to do, were things that I hadn't done before. So it was taking more of my time. And then in 2019, my dad had, in May, about the end of May 2019, my dad had a massive stroke and he passed away. So at that point, my mom was alone, and it very quickly became evident that she had cognitive issues. I think they were kind of, hiding it, helping each other. So we got her diagnosed with dementia, and she started to decline, especially after COVID-19. We were all in lockdown. I wasn't allowed to visit her in person anymore, and she quickly declined. Eventually, she was diagnosed with Lewy body dementia and passed away in September of 2020. So I guess this story really is about all the things that I learned from this. I think these are all things that we need to prepare for as we age, as our parents age. We need to talk to our children about these things. And some of the things that I learned that I think would be really helpful to think about is to make sure your parents have a will, know who the power of attorney is going to be for finances, for healthcare. That's really important. Know what their funeral plans are. The last thing you want to do is be trying to make decisions when you're under a stressful situation. It's really helpful to have that. I think also understanding their financial situation. Personally, I did not know the full extent of my parents' financial situation until my dad passed. They were always very private about it. I didn't know if my mom was going to have enough money to stay in assisted living. And I had to spend a lot of time kind of gathering together all the information and consolidating his finances so that I was able to handle that for my mom, because at that point she wasn't able. And also get to know your parents' banker. So if you need to be on their accounts so you can help pay their bills, you want to do that, and the bankers, can really help you with that information, help you kind of navigate that process, what it looks like. And also you should know, Jaylene mentioned long-term care insurance. Do they have long-term care insurance? My parents had a little bit. It covered maybe a third of it. Do they have other supplement insurance? Maybe they have some Medicare supplements or VA things that can help. The VA is great. They helped with my dad a lot. They have a lot of resources too. So you need to kind of be aware of those things. As Jaylene said, I didn't know that Medicare doesn't pay for long-term care until we got to that time. I didn't know about the Medicare 3-day rule. And so there's a lot of things you should kind of educate yourself on. And then also get to know the administrator and staff if your family does have to go to senior living. That's a really valuable partnership that you can help them and they can help you. They have great resources and can really support you in helping take care of your parents. And then also get to know their doctors. I think that's really important too, because I had to be an advocate for my parents. So oftentimes, they're that silent generation where they were not going to push back or they're not going to question the doctor. And while the doctor, their primary care, might have good intentions, it might not always be the best decision to not see a specialist. So the last thing I have to say is really make sure that you're taking care of yourself as well. That's really important. If you're that primary caretaker, you still have support from your, don't fail to ask your family and friends for help. I had a lot of help. If you have family that have financial expertise or that have medical background, rely on them for a lot of things like I was able to do. And then, and also just for breaks. I have a brother that lives in Arizona, and he couldn't help a lot, but he and his wife offered to have my mom come visit them after my dad passed for a few weeks. And that was just a great break for my mom. Gave her a distraction, but also just a great break for myself as well to feel that, time to kind of decompress after all the events that had happened up to that point. So again, my advice is to plan for this. We're all going to age, and we should all know, have a plan and be thinking about this ahead of time, because when the moment comes or when those times come, it's hard to make those quick decisions. And I'll turn it back over.
Teresa, thank you very much. That was a good summation of the statistics that David shared and what's going on in the world that Jaylene shared, and then you talk about it from a personal perspective. We had a couple of guests that were introduced at the beginning of our program today, and I'm going to toss the very first question to the two of you. So as the microphone comes your way, I'm going to ask, what kind of plans is our city making in terms of people like me that are getting older and things are beginning to change in my life?
Yeah, so a lot of what we do within the planning department and then the city in general is we have what's our long-term plan, which is a lot focused on our physical planning, where we're going to grow and how we're going to grow physically. But within that, a lot of the assumptions are based on the information that David already shared on the demographics. And so built into our plan are these demographic numbers that are saying that our aging population is going to increase dramatically over the next 10, 20, 30 years. And it's going to stay that high, too. We don't see it go back down again in 2050. It stays elevated. And so within our plan, we have a lot of policies. We don't have a lot of, we don't implement the plan, but we support those agencies like Randy's that do a lot of the services in the community and to implement things. But we are very supportive of trying to get more of these facilities constructed and approved. And so our plan allows for that to happen. And we note that in our plan. Another thing that we have built into our discussion when we think about the future is we are beginning a conversation about complete neighborhoods. There's a lot to talk about there. But within that is what type of services are available nearby or at least easily accessible or more easily accessible for our aging population. We have to do a lot more with that. We are probably behind when it comes to that, but we want to have that discussion. So that's a kind of the beginning of the answer of that question. That we are aware of the situation, but we need to do a lot of work moving forward.
So Randy, as he passes the mic over to you, I'm going to ask, he's kind of led the way in saying, this is what we're doing to make it an aging-friendly city. What else can you add to that?
Sure. It's a real work in progress. We talk about the aging population and often think about the latter years in life, 80s, when there's more health care needed and housing needed. But we're making a real shift with seniors now. That younger baby boomer is more active. They want more choices, and they're going to live longer than those that are currently in their 80s. And so we're preparing for that. Come 2023, we will be building, or we're in the process of building, a new center out on the old VA campus called Victory Park. And there we will have the Schmeeding Center for Active Living, which combines nutrition, caregiver education, and health and fitness opportunities for seniors that want to be more active. The city's starting to make some small inroads for seniors. We, with AARP's help, built a senior-friendly outdoor fitness center that's over at the health department property as well. And when you think of Lincoln and how much we have to offer, there are so many opportunities like the trail system, for example, and the arts that have really been enhanced over the years, which makes Lincoln a very age-friendly type of community. But we want to know what other things we can do in Lincoln and Lancaster County to make it more age-friendly. And so in 2023, we will also be launching Aging Partners, developing a master plan on aging so that we have a 10-year plan going forward in terms of what are our gaps and what do we need to fill those gaps to be more of an age-friendly community.
Okay, thank you very much. We've had some questions come in from folks watching us online. And the very first one says, how can you engage retirees, and I'll toss this out here, or maybe even one of you two gentlemen in the audience, how can you engage retirees in the community in volunteering and other activities that they are kind of reluctant to do? Jaylene, you look like you have an answer to that. or at least you recognize maybe that's an issue.
It is because David probably has the stats to it. I'll give the anecdotal answer of the longer you have purpose in your life, the more active you are, the better health benefits you have, the more socialization you have. And a great way of having purpose is volunteering. I would first and foremost look at the resource of faith-based groups and those type of organizations, because those are usually your best places. If we can get our churches to engage in our seniors, to David's point, a lot of time and resources is spent on our children, and even in those type of settings, and how can we help build some volunteer programs within some of our faith-based organizations? That's a really good opportunity there.
Before we get over to David, I'm going to ask you, do you know the number of skilled nursing homes in Lincoln or in Nebraska that do accept Medicaid?
Roughly, yes. So all 13 in Nebraska do accept Medicaid, but they may be very looking at people's resources prior to having them come live with them. So they may all be Medicaid certified. That doesn't necessarily mean they're going to accept 100% Medicaid.
Okay. Do you have any further comments related to either of those questions?
I don't think so. Go ahead.
Well, I have one for you. Does an aging population bring opportunity for young people in jobs for health care and things that we want young people to stay in Lincoln to do? Looking at it from a demographic perspective.
Yeah, well, that demand creates opportunities as well as challenges. So, from the workforce standpoint, there's a lot of options out there. So if you can get your training and the skills needed, or a lot of times employers will train you or pay for your education themselves, because there's really going to be this competition for workers, especially workers with certain skills or certain departments. So I think the doors are wide open, so people just have to go into a field that they love, and develop that accordingly. Any other thoughts?
Jaylene, you want to add to that, or one of our two audience members?
I would just add that there is opportunity when it comes to workforce. I look at, though, Lincoln is a thriving community. We have a lot of amazing tech companies that are based here, and I will tell you, healthcare is hard. Working in healthcare is not an easy profession, and if I can work remotely in my home or work in a facility that's open 24 hours a day, 7 days a week, and is emotionally draining, I don't want to sell. It's the most amazing career you can work in, but that's looking at, how do you attract a workforce in work that is not easy.
Well, ladies and gentlemen, our past hour has been packed with information about the significant shifts that are about to happen as the baby boomers turn 75. For the first time in Lincoln's history, by the year 2025, there will be more people over 75 than there will be young children being born. And this means a lot of change in the Lincoln infrastructure, in our workforce, in our healthcare landscape, and so much more. The goal of this program, the Baby Boomers Turning 75, was to provide you with information regarding what Lincoln's significant demographic shifts resulting from an aging population. Our panel today, thank you very much, folks. Our panel today provided a lot of data and a lot of trends related to this issue. They talked about the impact on Lincoln's infrastructure. They talked about the impact on our workforce, on our healthcare facilities and capacity. And Teresa shared personal information about what went on with her. And by the way, the presentations will be available on the Community Health Endowment website after today's program. As a review, David talked about that in 2023, we're going to cross that line between the older than 75 and the younger than 5 line will cross on the graph. That there are more seniors living alone, including a lot more men living alone, and that's a challenge that we have to face. And the older we get, the more likely we will be to have disabilities. And from Jaylene, we heard about boomers having more options to live in assisted living facilities of all types. But the transitions within those facilities may not be as smooth as some of us may think they would be, and that there are facilities being constructed. And Teresa, thank you for sharing your very personal story with us, and I'm sure it's already motivated some people to take action regarding their families. Today's event was sponsored by the Community Health Endowment. This organization works to help make Lincoln the healthiest community in our state. They are investing in health-related projects and programs and convening forums such as this one on health-related topics. And thank you for taking the time to view this forum, and keep an eye out for the next issue that the Community Health Endowment identifies and sponsors a forum on. All of this as they seek to new and better ways to improve the health of our increasingly diverse, and I might add, increasingly aging population. I'm Randy Bretz. Thank you very much.